Yeah, I don't want to be part of it.
Okay, good morning, everybody. Thank you so much for joining our Return to Work webinar. Today, we are going to have the honor of welcoming two medical advisors to our board. They are going to be helping us navigate COVID as we return to work. First of all, I would like to welcome and thank you all of Los Angeles and Orange County for coming back to work today. It's a day that is filled with lots of emotions. We're very excited to have you back with us and to help rebuild and move us forward and progress as we navigate this all together. As I mentioned, we will have two medical advisors joining our board. So if there's any questions that come up, they will be by our side this entire time in order to help navigate through this time together. So first of all, I would like to welcome Dr. Vinky Chadha. Dr. Vinky has over 23 years of experience as an attending physician at the Northwestern Memorial Hospital in Chicago. He was a graduate of the honors program in medical education at Northwestern University Medical School. He medically managed inpatient hospital teams as well as outpatient practices at Northwestern Memorial Hospital for over 23 years. He was a site director for junior and senior medicine at Northwestern Memorial Hospital for 20 years. Dr. Chadha has earned numerous awards and accolades throughout his career, including the George Jost Award for Excellence in Teaching, the Top Cat Award for Excellence in Teaching and Education, and he holds the mark as the youngest attending physician to be inducted to the Doctors Hall of Fame for internal medicine at Northwestern Memorial Hospital. 3 years ago, Dr. Chadha moved to Los Angeles, where he decided to take everything he learned academically in the hospital with outpatient environments and apply that knowledge and experience to the concierge model of medicine. Today, he is affiliated with UCLA and Cedars-Sinai hospitals. We also have Dr. Ng. Dr. Ng is a board-certified physician in internal medicine and pulmonary diseases. He completed his internal medicine residency and pulmonary critical care fellowships at Cedars-Sinai in Los Angeles. Since 2008, he has been in practice in Los Angeles and has a thriving inpatient and outpatient practice. He remains committed to medical education and continues to train both internal medicine residents and pulmonary critical care fellows. He has won many Golden Apple Teaching Awards in recognition of his contributions to the internal medicine training program. Dr. Ng has also served as a clinical chief for the Division of Pulmonary Diseases and Critical Care Medicine for the past 3 years. And also, over the past several months, Dr. Ng has been an integral part in the COVID team at Cedars-Sinai. He has treated dozens of patients with COVID, many who have been critically ill and in the intensive care unit. He is well-versed in the diagnosis and treatment of COVID and is an expert on the general practices required to maintain a safe working environment. He has been given many interviews and continuously evolving disease. We've also provided links and web sources in order to learn more about these medical advisors. So please join me in welcoming Dr. Chadha and Dr. Ng for taking the time out of their day to make sure that we are providing you with the most up-to-date answers and the most safe workplace. So Dr. Chadha, I'll hand it over to you.
Good morning. Actually, Dr. Ng is going to start with kind of an overview of corona and symptoms, and then I'll take it from there. Let me share that screen with a. So maybe you can click the next.
All right, hello.
So my name is David Ng. I am a pulmonologist. I'm going to start with some basic facts and overview of COVID-19 and the coronavirus. And then Dr. Chada, I'm going to hand it over to him, and he's going to talk a little bit more about how it kind of pertains to the workplace. So real quickly, the COVID-19 is the disease, and the SARS-CoV-2 is the virus that causes the disease, much like how HIV causes AIDS. So those are how those two terms are used. Coronaviruses have been with us for a very, very long time, and it typically causes a common cold. It typically causes, okay. It typically causes, symptoms that are what we call in the upper respiratory tract symptoms, or in the upper respiratory tract. It causes like a runny nose. It can give you a fever, and it can give you all these symptoms that you think of getting a cold, like a cough. These are novel viruses in the sense that the one that we've now discovered, called SARS-CoV-2, that causes COVID-19, tends to infect the lower respiratory tract, and that is more the lungs. That's why people actually get short of breath. They have much more of a cough. And this is different from the other coronaviruses that we have seen in the past. So it is very contagious. And there's a reason why it's so contagious. It's not contagious like Ebola. It's not like you see someone with Ebola, you see someone with the coronavirus, and you're going to get it. Its contagiousness has a lot to do with.
You sound a little muffled. So.
Should I take this off?
Sure, just take them out.
Yeah. Let me take this. I hope this is better. The reason why this coronavirus is so contagious has to do with some of the reasons why it's so unique. And one of it is the incubation period. And this is important because when people get exposed to something like influenza, you will get symptoms within a couple hours. You feel sick, you take yourself out of circulation, and you start recuperating. And you can't really infect that many people because you feel terrible. With this coronavirus, a lot of people don't have symptoms. Anywhere from probably a third to half the people are not going to have any signs or symptoms that they're sick. So they kind of circulate in the regular population. And also the timing in which people get sick usually is anywhere from 2 to 12 days. So if you get exposed to someone with this coronavirus, it may take anywhere from 2 to 12 days before you manifest any symptoms. And that's the amount of time you have to kind of circulate within the population where you potentially could infect other people. The little caveat is that most people are much more infectious when they have symptoms, and they're much less infectious when they don't have symptoms. The risk factors that you have for developing more severe disease tends to include age. While young people can get this disease, it tends to really affect the older members of our population. It is fairly rare to get very severe symptoms less than 60 years of age. It can happen, so it's not impossible, but it is not very common. Most of the people that are passing away from this tend to be older, in their 80s, 90s, 70s. There is a predilection for men. So men tend to get this more often than women. Not quite 60%, but more like almost like 58% is what we're seeing in the United States of men get this, opposed to 42% of women. The numbers are even more pronounced when it comes to severe illness. When we look at who's getting really sick, it does tend to be men in even higher percentages, upwards of, in some case series of like 70, 75% in the ICU. People who have pre-existing conditions tend to get more severe disease. But this is also a feature of just being older. As you get older and you see us doctors, we will find things that are wrong. But pre-existing conditions definitely lead to more severity of symptoms. One thing that has been unique with this coronavirus is weight. We know that people who are larger, who have like a higher BMI, who are overweight, tend to get more severe disease. So what are the symptoms that we typically get? The overwhelming symptom that most people say they get is going to be fever. This is going to be over 90% of the time. The second most common symptom is a cough. That's going to be upwards of like 80% of the time. Okay, then it becomes fatigue and malaise, which is just the general feeling of you don't feel good. The next one is shortness of breath, which is usually tied into a cough. And then one of the more unique symptoms that we have is the loss of taste and smell. That is fairly unique to this coronavirus. We always mention it's not very common, probably in the upwards of like 30–40% of the time people may have this. It can be very pronounced, where we have patients that are like chugging bottles of hot sauce and they can't taste anything. So that can happen. And then I always put in like nausea and diarrhea because it's not just limited to the respiratory tract. It can affect a lot of different organ systems, but the transmission is primarily through the respiratory tract. And when people get severely ill, it is usually because of respiratory illness. Okay, so this is gonna be my last slide, I think. So how is this thing transmitted? We like to, in physicians and the medical community, we like to divide it up into droplet versus like aerosol. Droplet is, think of it as if you cough or sneeze, there's gonna be bigger droplets that basically will get onto clothing, desks, computers. And then there's small aerosolized particles that kind of can linger into the air. Most of the transmission is gonna be through droplet, okay? It can get transmitted through aerosol, but that is not as common, okay? Because you have a limited number of space that you can actually aerosolize into. But most people are transmitting through droplets. That is, they cough something or sneeze something out, it gets onto a table, someone touches that table, then they touch their face, they touch their eyes, and they get it that way. A closed environment is much more conducive to spreading this than it is in an outdoor environment. So when you're outside, when you have a lot of airflow, it is much more difficult to spread. Temperature does play a role in the sense that the virus itself is not quite as hardy, and it is temperature sensitive. It is also light sensitive. It does not like the warmer environments, but that doesn't mean it can't get spread in a warmer environment. In terms of the degree that is really necessary to kind of make it more difficult for this virus to spread, it's actually not as warm as we think. It's probably in the 50s to perhaps 60-degree range, where it has to get warm enough for the virus to really reduce its transmission. But again, it does not mean it cannot get spread. In Los Angeles, it has been relatively warm over the last several weeks. And right now, we are having our largest spikes ever in cases. So even if it's warm, unless we do certain things and mitigate with certain practices, it can still spread, but temperature does matter. I'm gonna hand it over to Dr. Chada now.
David, thank you so much for that overview. I think a lot of us, when we think about COVID, our mind tends to wander to some dark places and our anxiety levels tend to rise. So what we're here today to do is to help you educate you on the facts so that the next time you're thinking about COVID, you'll have a much more logical approach to thinking about it and your mind won't wander and your anxiety will be hopefully lessened. What we want to do here in the offices, and as I walked in, it was beautiful to see the spacing that you guys have already developed. But what we want to do here in the office is I wanted to describe the protocol and why we're doing each thing. So one of the things that we want to do in an environment of work is to limit anybody coming into that workspace who is ill. So obviously anybody who feels sick needs to call and to their bosses and discuss their symptoms. But we will also set up a vetting process here, which will include temperature and a COVID questionnaire that describes symptoms and exposures. Because what we want to do there is to try to vet as much as we can, limiting people coming into the office that might be a source of transmission. Now, while temperature and questionnaires are not perfect, they will help us screen who should not come into the office. So you'll walk into the office, you'll get a temperature, you'll get the questionnaire, you'll Purell your hands, and then they'll be confirmed, you'll get confirmed with your mask, right? And there's a lot of rhetoric out there about masks. You know, are they really of any benefit? And so that rhetoric, we really need to turn into science. And most recently, there has been some significant data that suggests that the mask itself, in an environment where someone is exposed to COVID, reduces your risk of transmission as much as 6-fold. So wearing the mask really shouldn't be rhetoric in this setting. It should be mandated, because this is going to really protect you. After you get the mask, you're going to go to your workstation and you're going to wipe it down. As Dr. Ng was describing, you know, these particles landing on surfaces certainly can be a source, probably not as much as someone coughing and sending those respiratory particles, but the employee will be asked to wipe down their surfaces. The distancing that I see outside in this office is tremendous, right? What's the science behind distancing? And there is significant science about even as much as 3 feet being a benefit compared to obviously being right in someone's face. 3 feet, 6 feet is better than 3 feet, 9 feet is better than 6 feet. In this office, I'm seeing a beautiful spacing. That also can reduce transmission as much as 6-fold as well. And the mask plus distancing are complementary. The final thing not on this slide is eyewear. Some people feel like if they protect their eyes, there may be another benefit. So wearing glasses may be another option for you. The data there is not as clear, but certainly when you walk in, we want to make sure that you're not sick with questions. A simple temperature is a piece of circumstantial evidence. We want you to Purell your hands. We want you to mask. We want you to wipe down, and we want you to be socially distant. Those are things that will significantly reduce your risk of getting COVID, whether you're in the office space or you're outside. These are things that science has shown to be beneficial. We can't get your risk down to 0, but we're going to get it very low with those maneuvers. So what else can you do? Is there a magic supplement? Is there anything else that you can do to really enhance your immune system? And I really feel that mental health and handling your stress is very, very important with getting sick. There is significant data that shows that if your mental health, if you're optimistic, the chance of getting a viral infection is significantly reduced compared to someone who is stressed, maybe 2 to 6 times more. So hopefully you're going to have us here to talk to if you're feeling uncertain about something, and we can help navigate that situation for you to make you feel better about this whole COVID situation. Exercise. When they looked at exercise, moderate exercise, again, appeared to enhance the immune system. But now there's some people who are really intense exercises that may in fact reduce your immune system. So moderate exercise, making sure you're getting sleep. I think limiting alcohol intake, having some alcohol is fine. Excessive alcohol is not. But what we're trying to do here is create an environment where you feel safe, where you are not worrying about COVID. Obviously, you have to be disciplined about the things we discussed, but I believe here that we can keep and limit this chance of transmission to a very, very low level. We're gonna get to your questions up next. I want to talk about some things that, and I'm going to bring David in to discuss this with me, but some questions that I know are going to be on your mind. So David, I'll bring you in here with me. And we'll socially distance.
Yeah.
But what happens if someone gets exposed to someone who has COVID? So David, you want to take that question on?
Sure.
What happens if someone in the office here gets exposed to COVID?
So the much of this question is going to hinge on the type of exposure you have, right? So if you just happen to be in the office for like 2 minutes with someone who later tests positive and everyone's got a mask on, that's a very low risk exposure, right? But if you're in like the same room for like an hour and both of you are eating and you both have your masks off, that's a much higher risk exposure. So in the grand scheme of things, if people are wearing masks, you're really going to limit the spread. It makes it a much lower risk. If you are participating in any kind of activity that requires that you have a mask off for a significant amount of time, usually significant, I want to say is more than a couple minutes, right? More than 5 minutes.
Probably 10 minutes or
Yeah.
more.
Then you're going to increase your risk a lot. If you have a low risk exposure, we tell people you probably don't have to do much. You just want to monitor for symptoms, watch out for fevers, cough, melees, anything like that. But a lot of times we don't even advocate testing, although I'm a big proponent of testing. We'll get into that later. But that's what we typically do with a low risk exposure. For people with a higher risk exposure, we do tell them, look, you have to, I would say you should get tested, okay? You should watch your symptoms even more closely, and then you should probably quarantine, meaning you should probably not come to work, you should probably be at home, you should probably be away from as many people as you can.
Yeah, I think that you should keep for yourself a diary of who you've had significant exposure with. And that again goes to what David was saying. Significant exposure is someone you had contact with without your mask at close distance, because we're gonna need to know who those people are that you had that significant exposure to, and it will help dictate our protocol. We're going to individualize every situation. We're not going to use the same protocol on everybody who has an exposure or has somebody who has some symptoms to somebody. We're not going to use the exact same protocol. We're going to analyze it. Not everybody in the office needs to necessarily get tested, etc. Do you agree with that?
Yes.
Okay. David, what happens if someone in the office gets sick?
Yeah. So, you know, with the way testing is and with the delay in the kind of incubation period we have, if someone gets sick, I mean, the first thing in this environment is, I don't want to say you assume, but you kind of do assume that this is going to be something like coronavirus until kind of proven otherwise. Unfortunately, with testing, it can take a while to prove otherwise. So if someone has like a fever, right, malaise, all the signs and symptoms of a COVID-19 infection, then they cannot come to work, they automatically quarantine. And then we should go through your roles to see like, well, who potentially has been exposed to this person and what kind of exposure was it, okay? Knowing that if it's a mild exposure, then you just kind of monitor symptoms. If it is a much more prolonged or severe exposure, then do we go towards more testing? Was there enough of an exposure for that person to actually be quarantined as well?
Yeah. And I think if you get sick while at the office, you need to tell someone immediately. We need to get you separated. Then the office will call us and we will help navigate that situation. We need to get you separated from the office and home in a safe manner. So all of that can be discussed on an individual basis as well. What happens if someone in the office turns positive for COVID? I think you've discussed that a little bit, but can you talk a little bit more about that?
Yeah, it's so if someone let's say gets sick and turns positive, it's very similar to what we discussed with the exposure and also when they get sick. So again, determining who was exposed, the duration of exposure, the kind of exposure, and then actually seeing if they need to be quarantined. Like those are the mitigating factors that we would have to take.
Yeah. Okay, Sunny, why don't we get to some of the questions that some of your employees had, and we can try to get through those questions.
Sure. So the first question I have is, does wearing a mask actually protect you? And any thoughts behind cloth masks actually being not healthy for you?
Yeah, I think that masks are definitively beneficial to you and protect you. And in some of these studies that I saw, there was some in China as well as the United States. The reduction, people who had household contacts, people who had household, people in their household who had COVID, the other people that were wearing masks, the risk of developing COVID was less than 3%. Compared to people who weren't wearing masks, the risk is about 10 to 15%. So significant benefit to masks, whether you're using it as a preventive strategy or if you have some exposure. Now, as far as masks and concern about masks, David, do you know?
Yeah, so a couple of things is masks, I want to emphasize this, masks absolutely stops and prevents the spread of disease. It's not perfect, it doesn't guarantee it, but it absolutely will stop you from spreading it, and it probably to some degree will help prevent you from getting it, okay? But nothing is perfect, all right? But it absolutely helps mitigate this disease. It is probably one of the biggest mitigating factors that has allowed us to kind of flatten that curve, so to speak. In terms of using a mask and having some kind of respiratory illness, no, you don't retain CO2. There's a lot of nonsense that's out there. For some people with very severe pulmonary issues, they can have problems. That is true. But these are people with like really severe emphysema, severe interstitial lung disease that cannot handle wearing a mask. But it is absolutely safe for 99.999% of the population.
Yeah, I think number one is masks. Number two is distancing. Number three, washing hands. 4, probably eyewear. But the eyewear is more protective for healthcare workers. All of these are complementary as well. They all are additive. So we really, every one of these things is beneficial to you.
Great. So is it better to wear gloves or not and just make sure you're routinely washing your hands before touching your face?
I'm not a glove guy, only in the sense that like wearing gloves is good, it's helpful, but you have to change it all the time. So if you wear gloves and you touch a desk, you touch your face, just because you're wearing gloves does not do you any favors. The problem you have when you're wearing gloves is you don't really sanitize your hands anymore. So you're spreading things much more frequently. So if you use gloves the way they're designed, meaning you wear it, you touch something, you throw it away, you put on a new pair, yeah, it's going to be helpful. But just wearing gloves in and of themselves is probably not going to be as beneficial than just washing your hands all the time. And I think people are going to be much more prone to washing their hands and keeping their hands clean when they're not wearing gloves.
Yeah, I agree with David.
I probably wouldn't do it.
I agree with David. I think regular washing of hands or Purell, anytime you touch a surface, remember to wash your hands or Purell. I think that's better than gloves.
If you want to, like, if there's certain instances you can wear, like, look, if you know you're going into a public area, right? Like an elevator, you want to put on a pair of gloves to hit the button, that's totally fine. Just make sure, right, that you take it off once you get out of the elevator and you don't touch anything while you have those gloves on. So those are just, gloves can be helpful, but I got to tell you, to use them the way they're designed to be helpful may ultimately make them even less beneficial for everybody.
Yeah, and I know Career Group has masks and gloves, but we also want to spare the PPE when we don't think it's a benefit. And I think that masks for certain, gloves, I totally agree with David.
Okay, great. Do you think that there's going to be a relapse or a surge in cases coming this fall and winter? And then also in regards to the response to the protesting?
It never went away. The cases should be at an all-time low right now. It should be going away. If you look at every other country, well, not every other one, but like a lot of countries in Europe, most countries in Asia, it went away. Like they would have no cases. Unfortunately, in the United States, it has never gone away. In fact, cases continue to climb. So there won't be a second wave. It's just going to continue. Is it going to get worse in the fall and winter? Everything says yes, it will. It is going to get much worse in the fall and winter. So we are in the healthcare community are very, very, very worried about that. We're worried because, you know, when the hospitals are not overrun, we have time to treat everyone and everyone gets better. Not everyone, the vast majority of people get better. When we are actually completely overwhelmed and everything is full, and we have to put together makeshift units, then the level of care just goes down. So yes, we're all worried about a potential surge. What we're seeing now, at least in Los Angeles County and also parts of Florida and Arizona, are probably from Memorial Day weekend. We will see the impact of the protests in the next couple of weeks. Everything is delayed, which is very difficult for people because, again, this is what is so insidious about this virus. What you do now won't become manifested for several weeks, probably 4 to 6 weeks. Initially, it's 2 to 3 weeks, but like Memorial Day and with the protests, it's younger people. So most younger people don't get very sick, but they're going to go home to their parents. They're going to see uncles. They're going to see grandparents, and they're going to get them sick. So you have a little delay until those people get sick, and then you have a delay until those people get symptoms and until they get hospitalized. So that's why there's going to be like honestly, probably like a 4 to 6 week delay.
Yeah, I think that they're not necessarily a surge like we had initially, because the first time that we had, when we shut down, the virus had already been brewing for several weeks and we had no mitigation strategy. So there were several weeks we went on this spike, then we slowly have come down, and now we have reemergence. There's going to be some cases because of Memorial Day as well as the protesters. I don't see necessarily that huge spike again where we shut down everything in our country, because I think there's still a majority of the population that is worried and are going to be smart. So I think we have to see how it plays out. I think still the majority of our population is really being smart about this and using the masks and washing their hands and limiting large gatherings. So, but we'll see.
Okay. Are you guys seeing any other measures that other companies are doing that they have in place for transitioning back to the work or managing shared workplaces that you can advise on?
I think what you guys are doing here, you know, some people are waiting to start, but what we're doing here with the vetting of questions, the temperature checks, the distancing in this office is absolutely terrific. The mask mandate, I think everybody is going to be wearing the masks. Washing your hands and having the access to the sanitizing solutions are really the main gist of how you're going to keep this at bay. David, do you have any?
These are everyone's performing variations of the same themes.
Yes.
You know, some people want to add more physical barriers, but you need to have space and you need to wear masks and you need to wash your hands. That's pretty much about it. If you do that, everyone's going to be just fine.
Yeah. If there have been coworkers in the past that have had it, or that they've known others to have had it in the past few months, are we safe to be around them now?
Yeah, are you? So let me see if we can break that up. So, you know, how infectious, I think that question is like, how infectious or how long does someone stay infectious when they've contracted COVID? You know, it's probably much shorter than we think. When we look and when we're actually kind of looking at the data, you know, the duration of time that someone actually is infectious is probably less than a week, in all honesty. You know, they can still test positive, but it doesn't mean they're infectious. I think for most places, they take like a 2-week time frame, and I think that is more than enough for someone to no longer be infectious and get reintroduced back into the workplace.
Yeah, I think that, you know, you're probably infectious maybe 1, possibly 2 days before you have symptoms, and then about a week later, you're done. They've done studies on this and they can't culture it. Like David was saying, you can get swabbed again and it'll still show the virus, but you're no longer infectious. And the CDC says you have to have these three things to return to work, right? 10 days, no fever for 3 days, and your symptoms improving. So generally it's a 10-day period, and then
I'll tell people to go to 2 weeks.
Yeah.
Just to allay more fears. But usually it's a fairly short time frame. And then if it's months ago,
yeah,
I mean,
no risk.
you're pretty safe.
No risk.
They're in fact the safest people for you to be around.
Correct, because we believe that they can't get it
They
again
probably
if they have the right antibody.
They have some degree of immunity.
Yes.
Okay. If you have a family member who is immunocompromised, now being in the office and expanding the circle of people, will it be still safe to see them, or what can I do to prevent exposure to them?
Well, I think that if they wear masks, okay, in the office and in the outside world, masks and distancing, their risk is going to be low. Now, when they go see that immunocompromised person, there's still some risk. So again, you need to distance and wear a mask in that scenario. And you have to weigh the benefits of that relationship, what I think are very important to seeing those people with some risk. So again, when they go see those people, the grandparents or the person with taking an immunosuppressant drug, they should continue to use the mask, and they should distance. David, anything?
Yeah, I think if you have a pretty, if everyone's able to maintain a pretty safe working environment, if everyone's really conscientious of when they don't feel well, if everyone, is able to get testing when they don't feel well, so when someone's been exposed, then I think you can potentially be still able to interact with those family members, because, obviously if a coworker tests positive that you work closely with, then you know that you cannot visit them for a certain amount of time, be it 2 weeks or, whatever makes them comfortable. So we can't guarantee it. Exposures can lead to increasing risk, but I think the risk can be made small enough with a good work environment.
Yeah, and I think it also depends on the personality of the individuals involved. Some people don't want to take on any risk. Some people want to take on a little bit more risk. But if you do the masks, if you do the distancing, I think there is a middle ground of definitely having an interaction with those people. And I think it's probably very beneficial for both people involved in that interaction.
Okay. Does being on antibiotics weaken your immune system? And would it be safe to be in the office during those times?
And it does not weaken your immune system. So like if you have a urinary tract infection and want to take some antibiotics, you can still be in the office. But if you have any signs and symptoms of an upper respiratory tract infection, you shouldn't be in the office regardless if you're on or off antibiotics.
Agreed.
Okay. Now the question, because obviously we have San Francisco and New York locations, so there's a big question about public transportation and being close in proximity. So navigating that, obviously we'd have to follow any guidance that those cities give in relation to public transportation. But until then, do you have any recommendations for safety while having to commute using public transportation?
That's very, very difficult. So I don't think either one of us, I certainly am not aware of all the late-breaking measures that New York City has taken for their subway systems. I can just tell you that one of the reasons why things spread so fast in New York was probably because of the subway systems. It's very crowded, it's very old, there's poor ventilation, you can't socially distance, and it's this enclosed space. And that is the perfect environment that allows this virus to foster. So you need to avoid that or minimize that as much as you can. That's a very, very difficult question to answer, especially for us when we're not completely privy to everything that's happening in New York. But I personally would want to avoid public transportation like that. I can just tell you in LA County, like with the buses and the metros, they've really restricted how many people can go on that. So I don't know, we don't have a completely robust public transportation system. but I know like they've restricted like where people can sit to try to maintain certain distancing. You have to be very cognizant about washing your hands, but I would not get onto a crowded subway at this point, bar New York for any reason at this time.
Yeah, I mean, if you're going to be in that system, you definitely have to have a mask. You need to wash your hands immediately after you leave. You have to try to distance as much as you can. But that situation is a little bit tricky. And I would guess that New York, and I don't know for sure, would try to limit.
Yeah,
the
I know
numbers.
they're washing. I know
Yeah.
they're really cleaning their subways as much as they can, but you know, those are just higher risk environments. They just are. And I don't know if there's much more they can do about that.
Right. Do you have any safety recommendations for pregnant women specifically, or any information regarding side effects to a mother's fetus if you develop COVID?
So right now with COVID, you know, oftentimes, you know, pregnant women were thought to have increased risk of viral transmission of other viruses. In COVID, it's not been shown that they are at higher risk. And as far as transmission to the baby, it's still being looked at. You know, there's some babies that are being born and they are COVID positive. It's unsure if that is from what we call vertical transmission from a mother to baby in utero, or if that's from exposure once they come out. But right now, you know, there is some data with pregnant women and having a little bit more premature deliveries, but to the pregnant woman itself, there's not an increased risk. Anything else?
Yeah, it's pregnant. It's not a risk factor. They don't get severe disease. We think that there's something. We're not quite sure, but there's a male predilection. You know, we're looking into, is there something protective about female hormones, which are even higher when you're pregnant? So, you know, we have not seen a lot of problems with pregnant women and COVID.
Okay. Let's see. How long do germs stay on surfaces? And then how long, I know you mentioned this earlier in your presentation, but is it really recommended twice a day, or what would you recommend as far as wiping down workstations?
So how long this potentially can live on surfaces is depends on the kind of surface.
Mm-hmm.
You know, for clothing, for hair, you know, it can last. Like there's some trials that have shown that they can last for even upwards of a couple of days. It probably doesn't last that long. You're probably looking at a couple of hours. It kind of varies, but it can stay on surfaces, I would say, for a couple of hours. Usually after about a day, you're pretty good. You know, I can tell you in our offices, we've moved towards wiping down our doors and workstations at least twice, sometimes 3 times a day, depending on how crowded it's gotten. So usually we'll do it in the morning, and then one time around noon, and then another time right around 4 or 5. So that's a pretty reasonable protocol for surfaces.
Yeah, the thing is, if you do touch a surface, you're going to wash your hands anyway. And I think here everybody has their own workspace, and no one else is going to be using that most likely. So you don't have to necessarily wipe that down if no one else is using it. But the common surfaces, if you touched that, you should go and wash your hands. But I think that protocol that you suggested seems very reasonable.
How about, what would you recommend as far as a protocol for shared spaces or small spaces like elevators where you can't 6 feet distance?
Everyone wears a mask, right? Wash your hands immediately before you get on and get off, and just be very, very conscientious. I mean, those are, you know, like in the hospitals, we have elevators. Like you can't distance. It's very difficult. So those are very, like, this goes into like how risky the exposure is. If you're in an environment for a limited amount of time, less than a couple minutes, and everyone's wearing their mask, you're probably okay. That's a very, very low risk environment.
Yeah, the time you're in an elevator is probably less than a minute most times. Maybe if you're stopping on several floors, but even that, you need a 10-minute exposure. And if you're wearing a mask, it's going to reduce the risk again. So I think it's low risk overall.
Yeah, especially when there's fewer people, you know, packed, everyone's crowded
Yeah.
together is a problem. But now that everyone's kind of a little more cognizant, no one's
Yeah.
really packing the elevators, it's probably okay.
If you want to remove your mask for a phone call or to take a sip of drink or eat at your desk, but you're more than 6 feet away, is this putting others at danger?
You know, but I mean, potentially, like anytime you take your mask down, you can spread, and you may not know, like you have this incubation period where you potentially can spread this disease. So look, you have to take your mask down to eat. You have to do that. There's no, you can't get around it. You have to do it to drink. So you just want to be in a much more controlled environment. When it comes to being on the phone, I can tell you that speaking can aerosolize. Speaking loudly, singing can even aerosolize even more. So I will tell you, if you're on the phone, your mask should be on. And yes, you can be potentially exposing other people.
Yeah, I think if you're distanced, that reduces that risk. But everything again is complementary. So as much as you can wear the mask, you should. Obviously, sometimes the mask feels claustrophobic in a sense, and opening it up for 10 seconds, I think is fine. Putting it right back. But I agree with Dr. Ng. You want to try to limit those times as much as you can. But go ahead, Dave.
Yeah, if you're alone in your own office on
Yeah.
the phone, you're okay. But if you're in the office or you share an office or someone else is in the office, I'd say put a mask on.
Okay. So there's been a lot of dialogue as far as potentially people having COVID back in December and January. Is that really do you guys from your information, is that likely to have happened, that a lot of people had it in December and January?
We see very few people with that.
Yeah.
Yeah, we wish it was true. We both wish we had it, but it didn't happen. We see very, very few people that actually got it then.
Huh? So just a few more questions. Let's see. So I know you guys have talked about this several times, but just to kind of finalize it, what would be kind of the parameters, the safest way to prevent COVID? Masks, secondary, what are kind of those steps?
Hand washing, number 2. Mask, hand washing, and then just distancing, you know, limiting like enclosed environments as much as you can. Like those are definitely the general principles.
And one of the last questions.
Yeah,
go ahead.
Well, there's one question I think from earlier, and it was talking about, and these are questions. There's a question I wonder myself is like, when does this all end? Like, is this going to be life? Is this going to be how this is forever? And the answer is no, right? This is not going to be. I mean, there's going to be some changes for the better, right? We are now more cognizant of washing our hands. We should be that. We should be doing that. That's good. I don't think masks is going to be forever. I think this is going to be a temporary thing. So this pandemic, this ends when we have one of 3 things, okay? 1 is a vaccine that is reasonable and safe. 2 is early treatment. In other words, you get it, you get exposed, you can take treatment that does work. And 3 is we get what they call herd immunity, where enough people in the world, in the country has gotten it, where the disease itself is just cannot spread anymore because there's no more new host. That usually takes upwards of 70% of the population being affected. That's the longest, that's the toughest. You heard all this thing about Sweden. They want to get herd immunity and they let people kind of out and about. With everything that they did, they have roughly like 8% of their population affected, whereas like in California and Los Angeles, we have about 4%. They're not even close to herd immunity. I think everyone should really, really hope for a vaccine. I think that's going to be our safest bet, and I'm hoping, you know,
It's
within
on
a year.
track right now, but obviously we'd love to see that stay on track.
Yep. Hopefully 6 months.
Yeah.
Maybe less. We'll see.
Okay. Is there any concern about with the ventilation systems and if they're not proper, that creating or causing more COVID cases?
No, I don't think the ventilation plays, I mean, obviously, you don't want to have an old system, but I don't think ventilation plays a big deal here in transmission. David, what do you?
Yeah, I mean, you want to have a good ventilation
Yeah.
system. You know, like we don't have in certain places where you have known high risk exposures, yeah, you need HEPA filters.
Yes.
Here, I think your building said that they were turning over the air rather frequently.
Yes.
So that's pretty good. They're doing a pretty good job with that.
Okay. So going back to, having to remove your face mask to, take a drink or grab a bite to eat, where would you recommend people take their lunches?
I think
In LA, outside.
yeah, that's what I was going to say. If you can go outside, I know there was some concern about elevator use, but if you have a lunch and you can go downstairs and sit outside, I think that's the best. If you have an office, sitting in your office by yourself, I think is probably second best. Those are probably the two best. And then obviously spacing. If you can have your lunch and eat it and be spaced,
And just limit how many people are in that room.
And
limit your exposures. I mean,
Yes.
the general principle is the masks are very protective. So if you are in a situation where you have to take your mask off, you want to limit the duration and time.
Yeah. And then what are your guys' thoughts and philosophies around testing?
I love it. It's just our tests haven't been ideal, but I would test as frequently and often, knowing that there are limitations.
You're talking about symptomatic.
Yeah, so I mean, so we should break that down because there's two kinds of testing. One is the current PCR testing, which is the swab that tests people to see are they actively infected and potentially are they contagious. And the second one is antibody testing, which is just a test of prior exposure. So on a population-wide basis, it's always good to get antibody testing because you get a general sense of how many people potentially can have immunity, how many people have been exposed, et cetera. When it comes to the workplace, you really want to know who potentially could be contagious, and that is the PCR testing. The issue with the PCR testing in the beginning is with most of the testing centers, there is a false negative rate that's upwards of 30%. So the test itself is not perfect. That being said, if you're positive, you're positive, so you can get great information from it. We would test, I would test all the time. If you have that capability, if you feel like you've been exposed or if you feel like you have got symptoms, you should get tested. I like that, but there's just a lot of limitations to actually performing and doing the test. And then you have to interpret it correctly.
Yeah, I think if you're symptomatic, definitely testing is definite. You need to do it because we need to know not only for that person, but who they were exposed to, if they have a positivity. The testing can be improved by serial testing as well. So if someone's having fever and they initially test negative, but your thoughts are, hey, I really think this person might still have COVID, doing a second test improves it, and doing a third test, oftentimes it improves it further. So if you have a clinical suspicion that someone may have COVID and the test is negative, a second test or a third test may be appropriate in those settings. So anybody who has symptoms needs to be tested at this time in LA and probably in New York and San Francisco as well. San Francisco's not been hit that hard compared to obviously New York and then LA, but San Francisco has been relatively spared.
So any guidance, as you know, the government restrictions are lifting with restaurants. You see a lot of people, they're not wearing their face mask, and I mean, visually, they're clearly within 6 feet. What would be your guidance as far as the external environment starts lifting restrictions? If there's anything else we can do to better prepare ourselves in the office or about socializing outside of work altogether, any thoughts or feedback to keep our employees safe?
I can just tell you in Los Angeles, the cases are rising. And like they have to get mitigated. Like I love going to restaurants and I would not go. Any time where you have to where you can't wear a mask consistently, any environment where, that's the case, makes the spread of this disease much more likely. I shouldn't say much more likely, but increases the risk of spreading and contracting this disease. So, I mean, you can tell you cannot go to a restaurant and not wear a mask. You can't eat through a mask. Those are just higher risk areas. So when we look at why cases are spreading and where they're spreading, it's typically in states that have taken down some of those restrictions. And right now, I think it would be prudent just to wait, because this is not going to be permanent. Like, we just have to do certain things for a short amount of time.
Just a few patients.
Yeah.
Yeah, I mean, it goes back to the same principles. Large gatherings, which it could be a restaurant, close proximity, and no masks. You increase your risk of transmission significantly.
It's just a problem.
So be smart as much as you can. Or if you're going to go to a restaurant, I think outside, eating outside is the way that I would consider it.
Yeah. During the workday, would you say it's the best strategy to stay inside the building for the entire day, or do you think it's better to go down the elevator, go outside for lunch, take a break, and come back into the office? What's the better strategy?
You know, I don't think there's going to be a huge difference with either one of those. I agree. In all honesty,
it's a personality thing. I personally would love to get outside if I had a chance to. I don't think the risk is that significant going in the elevator. But I could also see that
you guys have a very safe workplace.
We have a very safe worker. The spacing here, the mask wearing, you're going to be low risk either way in this setting.
And the last question that we'll leave or end the conference call today at is, how are the medical professionals, government agencies determining whether or not it's safe to return to work? What's the criteria and process for determining that?
So, you know, this is when people look at this as individuals, I can just look around, younger environment, like younger people working here, the likelihood that that individual is going to get sick or very sick is going to be very, very low. When the governments and physicians talk about like how we open things up, that's a population-based discussion, where it factors in the number of cases, the hospital availability, the ICU availability, and that's how that factors in. So in places where there's not a lot of hospitalizations and there's not a lot of ICU utilization, you know, you can see opening up and seeing what happens. That's okay. But once those numbers get hit, once like you start seeing cases going up, hospitalizations going up, that's when things have to get ratcheted down. But for individuals, you know, the likelihood that a young person is going to get very sick is very, very low. But all these practices are all about protecting like the most vulnerable parts of our population, which tends to be the older ones, which tends to be the sicker ones. I don't want people to leave here and think, well, if I'm young, I'm not going to get sick. That is not true. We've certainly seen really young people get very, very, very sick, some of whom are not going to recover, but the likelihood is very, very low. I hope that makes sense.
Well, thank you guys so much. Is there any other last thoughts, final comments, advisement that you can give to all of us?
Yeah, I think the mantra should be what you do here in the office, you should continue to do at home, because we are in this together, right? When you go home, you want to see other people. Just be smart, not large gatherings. If you don't know somebody and you're concerned about that person, wear the mask and try to distance. So same mantra that you have here, try to keep that mantra at home. You guys are all in this together. You're going to do very well together. David, do you have any final thoughts?
This is going to end.
Like, this is going to end. We're going to have something positive is going to happen.
Yeah.
We're going to have other things besides the masks and distancing. We're going to hopefully get a therapeutic, a vaccine, or something that's going to turn the corner, that's going to be able to for all of us to take a big deep breath and say, okay.
This is not forever. Just be patient.
Yes.
Oh, thank you. Well, thank you guys, both of you, so much for your time, the information. I know it put me at a lot of ease, and a lot more confidence walking in through this together. As mentioned, we have Dr. Chandra and Dr. Ng on our staff to help us advise the entire process through. So we are one of the only companies have gone out this far in order to make sure that we've even hired medical staff to help us navigate this. So your safety is our utmost importance to us. So thank you all for being here, sharing your wisdom with us. If there were any additional questions that you may have had that we weren't able to answer, you guys can always email hr@careergroupcompanies.com and we can get those answered for you in a timely manner. And as always, if you're not feeling well, call Human Resources and we will work with you and work through this together. So thank you guys, and thank you all for attending today's webinar.
Thank you for having us.
Yep, take care.
Thank you.
Yeah, all right.
I'm gonna stop this just so it records it. Okay, thank you.